Topic for the day is inflammatory bowel disease. Most common one that you've probably heard of is Crohn's disease. There's also ulcerative colitis. Then there's the non-inflammatory, more of the irritable bowel disease, IBS, and malabsorption. So why I'm mentioning this is because I think that Western medicine is getting better, but I'd like to bridge. Get it? Bridge? I'd like to bridge your access to healthcare and wellness between Western medicine and alternative complementary medicine. So here it goes. The beautiful thing about integrative medicine is that it just gives so many ideas and references to access, reliable access to make a change. So the knowledge base of diet is getting better. I think most of my GI, gastrointestinal doctors, specialists, when they see you, if they diagnose no problems in just one of those problems, either IBS or IBD, usually they'll go to a FODMAPs diet. And I've done tutorials before. See DrRic tutorial FODMAP, FODMAP, and you'll see what I mean. It's nice because there's a lot of information out there. You can readily get texts, maybe some reliable videos and information. So this is good. Unfortunately, registered dietitians at the hospital under your insurance plan will not be covered. It's always good to invest if you can get a registered dietitian that is very knowledgeable, but sometimes you'll have to pay out of pocket, or perhaps a nutritionist. The investment is great because I think that there's a lot of change always coming about regarding the information that's available. And the FODMAPs diet, reproducible, great evidence, pretty decent. But this is the way I would do it. If you are on a medicine from a doctor, a specialist, and it's controlling your symptoms, cool. If you're on a medicine from a doctor and it's not controlling your symptoms anymore, you have to have some form of mindful practice. I always say that. There are great concepts, especially with the GAPS idea or the GAPS diet, where emotion will flare up your bowels or your gut. And the gut, if it doesn't work right, will also flare up your emotion. So it goes hand in hand. So you do have to have that practice. That being said, let's see my videos on nature therapy or guided imagery or mindful practice, and you'll get it, hopefully. But maybe get a coach, like a psychologist. Once you get that and you reproduce it, you have to reproduce that twice a day, at least 10 minutes, and for 3 weeks straight. And hopefully your brain and gut will appreciate it, and you'll just be finding it easier to continue on. Once that's out of the gate, you have to touch on your nutrition. It's probably the easiest and most damaging thing is nutrition. The only question is what's affordable and what's around you. So I would consider using that FODMAPs information, but because grain is so refined nowadays, and it's questionable whether people have a lot of intolerances to grain, I would usually stay away from grain, at least for 3 months or more. And yeah, it's going to be hard, especially if you're used to bread, pastries, cereal, rice. If you're used to that stuff, it's going to be tough to switch off. But if you know what's coming, and it could be glorious, you might make it worth your while. And as I always say, start planning, and before you know it, on the calendar, you've notched your 90th day and you're done, and you can reintroduce that stuff. First, you get and eliminate anything that's bad. Usually, I think across the board, grain is probably something you can get rid of. And then you have to learn about macronutrients, because if you don't have grains, you can't just go keep up your fiber with all your vegetables, because vegetables, depending on which vegetable, cold versus cooked, it could be irritating too to the gut. So you gotta learn to cook. Gotta learn to read what's in the aisles. Gotta learn to shop the periphery. Sometimes the center of the grocery store is okay, but try not to go too processed. So if you can substitute, then great. that'll get the offending agent away. And if you're not sure, sometimes it means that you have to get allergy tested. Blood allergy tests are helpful. Sometimes you will have to meet your deductible and have the blood drawn and look for intolerances or sensitivities or just plain outright allergies. It might give you a ballpark, but if you can't afford that or don't have insurance, do the elimination diet. See my tutorial. That's actually a question. DrRic question elimination diet, and it might give you some ideas. And unfortunately, I also think, in addition to grain, milk and milk byproducts, dairy, probably not good. Some can make the argument for grass-fed or free-ranged, no antibiotics, probably good, but I think the problem would be casein that comes from a cow is a little irritating. So get away all offending agents. And that also means coffee and alcohol. So you probably turned off the video at this point. So once you get the offending agents away, then you can start healing up the gut. So do no further harm. And then we work on building that microbiome up again. So here's the controversy. I think that if you have been hit, like the average American, many times in your childhood or younger years, your parenting years, with antibiotics, you have probably conquered the short-term bacteria that was giving you an infection, but you've probably also killed off a lot of that good bacteria in your gut. And usually you have to rebuild the gut, make it safe by having probiotics. The only problem is probiotics, or the bacteria that you get in probiotics, especially if you have Crohn's disease, there's a factor that specialists have found with regards to Crohn's disease that usually recognizes the bacteria in the GI tract and determines friendly or unfriendly bacteria. But sometimes that little gene goes haywire and it says every bacteria is unfriendly, and then it starts the inflammatory reaction. So if you happen to have that gene, not good. And then if you take a probiotic to balance out your microbiome, you'll be causing more inflammation. So you got to cool down the gut. L-glutamine, zinc, aloe, all these things will help heal the gut. Nutrient, anti-inflammatory foods help heal the gut. Once the gut has less permeability, because a leaky gut usually will let anything through, and you're not supposed to. The big proteins, once they get through, like cow milk, they cause an inflammatory reaction. Certain bacteria, like in the Crohn's disease patient, they get through, causes inflammatory reaction. Emotional stress causes an inflammatory reaction. All that stuff is bad. Medicines can cause an inflammatory reaction. So you got to get all those offending agents away, and then somehow, when the gut is ready, you have to reintroduce good bacteria, probiotic. And here's the catch. Probiotics, they need fiber and mucus, because probiotics are bacteria, they have to eat too. And if you're going a little lean on your diet and you have a whole bunch of bacteria in your gut trying to establish and push out the bad bacteria or parasites or viruses or fungi, well, if they don't have anything to eat, what are they going to eat? They're going to eat the lining of your gut. And that'll cause more cramping. So that's why it's important to establish a good layer, a wall in that gut. And then you can introduce the probiotic again. And you'll have to research your probiotic. Make sure it's got the right amount of bacteria, maybe a little prebiotic in it. But again, if you're hopefully prepping your gut with prebiotic, then you do that before even introducing probiotic. And then again, to link that to your mindful practice, you're solid and non-stressed out. So if you have the stress accounted for, if you have the prebiotic in and the gut a little bit healed and sealed, and then you get the probiotic in, not bad. Soon you might, if you're on medicines, be able to wean off those medicines. But here's a catch. Here's where I think integrated medicine is great. The studies that are out there, I mean, there's a lot of herbs that I already mentioned that you can take, but there's also low-dose naltrexone or medical marijuana. And this is where the doctors probably turn off the video. Low-dose naltrexone has been studied in the 80s with HIV, autoimmune disease, Hashimoto's, and Crohn's disease. I've actually used low-dose naltrexone even with irritable bowel syndrome, mostly IBS patients, symptom-dominant patients, and it has worked. But again, we have to pick and choose. It doesn't work for everybody. I've also moved on to prescribing medical marijuana. In my clinic, I don't give opioids anymore. I don't like Vicodin. Since I started certifying for medical marijuana, my patients are faring better. Medical marijuana, not street marijuana, great. Because of the CBD component of hemp or medical marijuana, it does decrease the inflammation to the gut. So you just have to be knowing how to dose that milligram dose, whether it's THC dominant or CBD dominant, or liquid or pill or smoke or vape, or even topical. I think that's what me as your designer, your architect for change, has to figure out. Me and the dispensaries that you're working with, what's available, what you can afford, all important. So again, medical marijuana, mostly CBD. If you can't do that, hemp-based CBD products, which are over the counter. If you can't do that, low-dose naltrexone. If you don't want to use the medical marijuana part, or you're the Department of Transportation driver, you can't do that if you have a DOT license. Low-dose naltrexone would be an alternative, and it has worked great, but it takes time. It doesn't work for everybody. But those two categories, or those two treatment plans alone might push the majority of my patients, after they've established mindful practice and nutrition and gut healing, might push them into getting rid of their prescription medicines. Usually those, the prescription medicines, or the biologics as they call them, are great. They help with a lot of patients, but number one, they're expensive, and number two, they are heavy with side effects. So if you don't have side effects now, or at least the side effects are better than the ill effects of the disease process, then the use outweighs the side effects. But sooner or later, there might be more side effects coming your way. So that's why down the line, you have to look at what usually accumulates as far as side effects to your biologic. Once you have control of the disease process, and I have some patients who have been able to get off their Lialda. Lialda is a medicine that sometimes is prescribed, very expensive, high side effect, but it does help. But I have had a few get off their Lialda, make lifestyle changes, lose weight, feel young again. Everybody gets a personalized plan. That's the way integrative medicine works. That's the way my patients in my office are supposed to be leaving. Everybody that leaves my office with a visit always has homework, and there is no 2 bits or pages of homework between all my patients that's the same. So it has to be a personally designed practice. So hopefully everything will springboard my patient into getting back to exercise, which would be the final key. Once you have established a mindful practice, a little bit of heal and seal to the gut, a good microbiome, a good tolerance for foods that you might be able to prepare on your own, and then maybe a wean down on your prescription medicines, then we gotta maximize that activity. And activity will always be linking everything together. I think activity, whether it's, you don't have to run, but I think that the great hormones that are released when you exercise and feel good will only help the mind, will only help the gut, and it's a positive feedback loop that gets you to that feeling that you had when you were 20. And that's what I want everybody to experience, is minimize the prescription medicines, get on some good food, have no suffering, and live like you were 20.